We have chief parties from different implementing partners. You are welcome. Colleagues from other NGOs and partners, you're welcome to this exit meeting. Colleagues from World Vision US, welcome and thanks for your support. Co-implementers and partners from RTI, again, welcome and be at home.
Approach I've seen in the programs and activities of SPEAR, theirs has not been saying we are giving you this, we are giving you this. Theirs has been we are empowering you so that you are able to lead a sustainable life that is respectable. I have the honor and the pleasure to declare the exit conference officially opened and therefore proceed and have good deliberation.
We have been supported because these ministries are key ministries. We have been supported by public service as the co-chair of the Project Advisory Committee to ensure that all the three ministries are brought together. We have been supported by Ministry of Health to provide a technical expertise as far as the implementation is concerned. So that is the profile of the actors of this program for the last 6 years.
Ministers have not been left behind, and they have had the opportunity to ensure that they lead by example. They have led by example. All sectors have led by example, as you can see. So that leadership has been very key. Like the theme of World AIDS Day in the previous years, re-engaging the leadership has been very critical.
First of all, I want to take this opportunity on behalf of Uganda Prison Service to express our gratitude to the SPEAR project for whatever they have done in the last 6 years in the fight against HIV/AIDS at workplaces, and in particular Uganda Prison Service. 2008, Uganda Prison Service signed a memorandum of understanding with SPEAR to enhance responses to HIV/AIDS, prevention, care and treatment to our staff. Because of this support, I think we went a long way, and we are proud that at least to a very large extent, the objectives of this program have been realized. You have asked us to give what do we have in order to sustain this program, and this is actually the gist of the matter. The achievements and so on, yes, but we are now more on the sustainability of the program as we exit. First and foremost, Uganda Prison Service has already developed HIV/AIDS workplace policy, and the structure is in place. That's number one, and we believe because of that we should be able to push through as SPEAR program probably come to an end. Two, Uganda Prison Service has an integrated HIV/AIDS approach to everyday activities in our service. HIV/AIDS program is already integrated. In other words, we are not looking at it separately. So even what SPEAR brought in has already been taken care of through integration. Number three, we believe that the sustainability of this project will continue because as much as, yes, we have very limited budget, but I stand here to confirm that we have some provisions within the budget to take care of HIV/AIDS program for staff. Currently, as I talk, we have over 600, actually 700 officers. When I talk of officers, I'm not talking of fellows with the Nyotas only. I'm talking of prison officers. Prison officers right from the rank of a warden up to the Commissioner General of Prisons. So as I talk now, we have over 700 staff, officers who are benefiting directly from the budget which is put aside within the health services to cater for these people living with HIV/AIDS.
So for funding, which is one of the critical areas, police leadership is aware of what SPEAR has been doing. We have engaged them several times with the team from SPEAR, and we prepared them for what is going to happen. And I would say, I'm happy to say, our police advisory board, which is a high-level decision-making body, has accepted this challenge and promised to create direct funding for these programs.
The HIV/AIDS workplace policy, we had received them in documents. In many schools, they were lying there as booklets. In our offices, they were gathering dust. Now, SPEAR came to unwrap these books for us and to touch the content. This content has unveiled so many miracles to us as people in Mbale. Rather, the thrust to promote and support positive living among these staff continues to gain momentum from time to time, and as a result, there is observable improved staff productivity. Ladies and gentlemen, I want to share with you that at some point personally, because I had not understood the challenge of 3 teachers, and if you have chance to know Mbale, Mbale is segmented in 3 geographical or physical regions: the hard to reach, the middle, and the plain land. Plain land is very accessible, and that is the one lying near Mbale. But the farthest point going towards Ronko is actually hard to reach in very many ways. These 3 teachers had sought transfer without revealing their challenge. And naturally, I had to tell them that they sought employment for which they obtained they had to work anywhere in Mbale district. I retained them in the high up, cool environment, rainy, muddy, and accessible. I want to say this, that the moment we interacted with the SPEAR, we started realizing that there was something that we were not doing to the people who actually hold us up there. And these were the teachers in class for whom, as district education officers, inspectors, pride in for performing as much as we are said so. It is until we started interacting with the SPEAR that we recognized that it is us who will support these people for them to produce the results for which we shall pride in. I want to thank SPEAR for doing that for us. The issues therein are many. There are teachers who are infected and affected. That's a reality. You can't hide away from it. And the performance at workplace is modest. Why? Because they are discriminated. They are harassed. They feel out of place. Up to today, down there in the villages and in our communities, people still believe that HIV/AIDS is a phenomenon for the misbehaved categories of people. They have not yet appreciated, although they know, the causes of HIV/AIDS. Therefore, you will find a situation where a teacher would want to work, but unfortunately the conditions around him or her do not give him opportunity to produce the best out of him or her. I want to say stigma, like the commissioner has said, is obvious, but the staff needs psychosocial support. Now, this all comes as a result of the struggle to cope with this pandemic. A number of staff haven't established their serostatus. That is a reality. It is an issue. And a good many of them do not realize that there are services that can help us to move. How have we existed with SPEAR vis-a-vis this pandemic? The first meeting I said SPEAR hosted brought us to full awareness. And we have gone ahead to carry out empowerment seminars to cause the teachers as well as the learners to come to believe that they are human beings and they still can live on with appropriate measures. We have done the VCT outreaches. Special consideration of infected teachers has taken place. As soon as we interacted with the SPEAR and my full understanding that it is me to lead the support of these teachers, I immediately issued a warrant of special consideration. Time is not enough for us to explain to you what goes on in education. A teacher does not have an opportunity for a special allowance if you did not know, especially a primary one. And the only opportunity is when he goes to supervise PLOE, I've been told 5 minutes remaining, PLOE exams. Now the PLOE exams gives a teacher only 12,000 shillings a day and they work for only 2 days. I want to tell you that teachers struggle to get this opportunity, but they never get it. In Mbale district, we need only 200 teachers to supervise the exams, but there are 1,621 teachers in Mbale district. So how many chances does one have to get that opportunity? Immediately as a DU, I said that every year, the group that has become MTAG in Mbale district, every member is guaranteed access, automatic, to that opportunity. And that shot our members from 12 to 32 immediately. And as I speak now, we have 78. They are pretty much like a drizzle in a desert. Others, however, present themselves for the cause and impact for which they were created. Such leave sweet and lasting memories on many people's hearts, much like a working marriage.
What has SPEAR done for us as Taga groups? It has already been mentioned. A number of trainings have been conducted. We have been empowered with the tools to work as linkage coordinators in the school communities and also at the community at large. We have also been helped at the level of increasing our levels of income through investment in income generating activities. We have also been helped at the level of sustaining our very precarious dear lives through care, treatment, and support. SPEAR has been identifying some money. For instance, in Jinja, the first check we received was about 700,000. After seeing what it had done through some investment in some activities, they gave us another check of 800,000. After seeing what that one has done, they gave us another check of 1.5 million. After seeing what 1.5 had done, we now received 2.1. And across the country, most Taga groups have been receiving such monies to invest in a number of group activities for economic empowerment or individual activities. SPEAR has been able to give. It was not uniform. There was no blueprint for support to the Taga groups. Support was given on the basis of how organized the group was. I think almost across the country, Jinja group is one of those that are really very organized. We have received almost the largest share of support from SPEAR. Of course, in Jinja, we have an office. It may come on at the end of my presentation.
Prisons, together with SPEAR, came up with interventions, and one of the interventions was capacity building. We trained a number of community resource persons, but because we followed the Ministry of Health policy, we said all of these community resource persons that have been trained must be retrained as VHTs, because this is a structure that is recognized by Ministry of Health, and it is referred to as Health Center 1. And as I talk, we have trained over those numbers, but we have not finished, as our commissioner said. We need more, especially in prisons without health workers. We had also safe medical male circumcision, and we had an opportunity to train 33 surgeons. Some of them are present here. Actually, those circumcisions are led by none but other than Dr. Kakorachi. He can stand up for recognition.
How has police and SPEAR intervened? We have decided to put up PMT City HCT mobile outreaches in different police barracks. For example, Zambia, Chireka, Naguru, Matuga, Katwe, and others. We have also we have also had linkage facilitators, including voluntary health teams. Mentor mothers have been also oriented and helped in antenatal care points, enrollment of new HIV positive mothers, and their subsequent follow-ups. These mentor mothers have really done a great job within the communities. And most of our mothers are not uniformed people. So we try to get non-uniformed mentor mothers. There's a way they speak the same language. So they understand each other well. We have also formed family support groups in various SPEAR Arts accredited sites, and these have helped to provide services and then improve adherence and retention of these clients. Actually, the support groups, under the support groups, we have mentor mothers and VHTs who go ahead and follow up the mothers who are transferred from different stations. Next. As a result, mobile outreaches have been done in the following sites. Like I mentioned before, those are the barracks we have managed to reach, and others which are not mentioned. Then outreaches have contributed to actually 69% coverage of PMT City services. Active family support groups have been formed in the SPEAR Art accredited sites. I have mentioned that before. And then mentor mothers and VHTs are actively participating in enrolling and following up these mothers. I've already mentioned that. Next. We have learned that outreaches have reached out to more pregnant and lactating mothers than static clinics. Linkage facilitators also, including VHTs and mentor mothers, have greatly assisted in enrollment and retention of mothers on option B+. They have been useful as a form of task shifting. Lastly, family support groups have provided psychosocial support that has helped in adherence and subsequent retention of clients at given health facilities. The following are the challenges that we have. When SPEAR came in, most health workers were trained, but then you find that some of these health workers are transferred to other places, which has led to less health workers that are providing these services. Then also linkage facilitators are on voluntary basis. That means we need time-to-time incentives to motivate these VHTs. Family support groups lack up funds. Sincerely, mothers come, they sit, we tell them the way forward, but still they need income-generating activities in order to take care of themselves. Because we talk of nutrition here, they say we cannot afford. And we cannot also afford to give them funds to start up income-generating activities. Next. So our recommendation is increased partnership and collaboration to support linkage facilitators, mobile outreaches, and family support groups. Then, like I said, the trained ones are transferred and then the untrained ones come in, so we need time-to-time refresher trainings on EMTCT for linkage facilitators and the staff, the qualified staff. Then the last recommendation, more incentives for mentor mothers and voluntary health teams. Allow me to thank the government of Uganda, Ministry of Health, USAID, the American people, management and staff of SPHERE, management and staff of Uganda Police Force. Please, thank you very much.
Another role was that they had to also roll out the condom campaigns, and this was spearheaded by SPHERE in partnership with UHMG, and we were able to do this in different police and prisons barracks. My presentation cuts across. I'm not only representing on behalf of police. So can we go ahead? What were the issues at hand? As you're all aware, police and prisons as uniformed personnel, we are most at risk. Is that so? Okay. So we required significant attention, and here we needed to involve the leaders. You know, without leadership and committed leadership, there's no you can move on. So we had to make sure that the leaders are involved.
We found out that less than 75% of the communities that we serve was uncircumcised. And also there was no clear policy concerning SMC at that time. And this has also been repeated. It was said by the chief of party, the prevalence rate, the risky behavior has just been talked about, inadequate infrastructure. And infrastructure ranges from, you see that word, that abbreviation, BECA. Infrastructure in the prison setting, we understand it as the buildings, the equipment, the communication facilities, and the ambulatory services. They were lacking, also inadequate knowledge, and also inadequate capacity to handle some activities as in the area of human resource. What were the interventions? This one has also been said. 8 SMC teams at Action Bay trained, but you had Kate giving a much bigger team to bring on board those up-country prison health units. 2 static SMC sites, one at Action Bay main prison, for those of you who have been at the Action Bay Hospital, and the staff clinic. Staff clinic is just near Upper Maximum Prison. Action Bay Hospital supervises other prison health units. That's how we are achieving by the so many. And also SPHERE helped us improve on the BECA as already mentioned. What were the lessons learned? We found out that SMC helped us discover some undiagnosed illnesses, like they are doing behind there. There is HCT going on, but you can achieve or you can acquire other services as well. There was increased uptake of other services. In fact, safe male circumcision has enormously helped bring men on board, male involvement, a program that really has helped many men come on board. Most programs have been favoring women. I think SPHERE really must stay, don't go away. Just maybe we have some little funding, and then partnership and collaborations be also improved. SPHERE, don't go away, please.
Safe male circumcision was a very new program in Karamoja region, and it was only supported by this single partner, SPHERE. There is no other partner that has been doing this across Karamoja. The implementation approach adopted by SPHERE. Last year, when SPHERE came across Karamoja region, they started with the district-specific mapping exercises of all the partners and other stakeholders that have something to do with HIV/AIDS. They conducted district entry meetings to inform the leadership at various levels, at district, sub-counties, and this was aimed at bringing the leadership on board to familiar them with this SMC, and also get the political goodwill from them. Sensitization of advocacy forum like the district AIDS committees, sub-county AIDS committees, and other coordination fora like the HIV/AIDS sector working groups in the districts was also done, because we sat in these meetings together with the SPEAR team. And the sensitizations were also extended to institutions like schools, the police, and the prisons in the region. So after all that was done, then we embarked on capacity building of a few health workers to provide the services in each of the 7 districts of that region of Karamoja.
On the side of SPEAR, SPEAR intervened or began supporting police in 2008, and it began by sensitizing all police commanders from regional, district to the lowest police commanders were sensitized and empowered with knowledge and skills to frontline the fight against HIV. This was aimed to ensure that the HIV fight is command driven. Next. Regional police clinics, district police clinics were facilitated to start offering HIV sensitization, HCT, self-treating prophylaxis, self-male circumcision, and later we started offering ART. So you are seeing that the clinic or the police medical services is all around. The interventions. SPEAR began by building capacity for both the medical staff in police and also the police officers who are not actually medical people. On the medical staff, we got a lot of training, including HIV comprehensive care, ART management, pediatric HIV care, PMTCT, EMTCT, to mention but a few. On the side of police officers who are not necessarily medical people, we trained very many behavior change agents across the country, a lot of village health teams, and linkage facilitators. Next. This is a picture showing the capacity that was built. This is a team of SMC surgeon offering circumcision at the clinic. Next. And that is a picture of village health teams immediately after they have finished their training in Masaka.
The SPEAR supported us with 2,500,000, but as a capital we started with 2,250,000 as an opening capital for the loan giving business, and then we were left with a balance of 300,000 in our account. Way forward, we request for more support to boost the expected projects that we expect to do when time allows SPEAR to do it for us, poultry and breaking lane. We really want to recommend this. More time contract for SPEAR and World Vision due to tremendous work they have done in reduction of HIV/AIDS and workplaces. Support to those already infected and their families.
Thank you so much, Hila, for holding us. I did the same. I'm here to only voice in a minute some up voices of all the commanders here. I'm telling you a story of the work you've helped us do in the last 6 years in a minute. Commanders, you will stand up for people to see you as I tell the people what the funds from here and the World Vision have done. Allow me to humbly request you stand up to this thing, especially my RPCs. Using funds from SPEAR, stand up for a minute and work to the people. Party Chief, I want to express my gratitude to SPEAR for identifying and having a very clear but sensitive HIV policy that looked at the needs that were in the police and came with a solution. You know, police, we don't have so many friends. at a police station in a day. Most people who come with problems. Yet when you came to give us a hand, and this is how you did it. You realized that it was police, it was the prison officers, it was the teachers, and government workers that were suffering with the challenge of AIDS. You saw that officers, yes, were dying on duty without hope. You looked at us and realized the budgetary fixes and implication that we have as a police force and our salary, and because it was small, and you came in. You gave us funds to support officers have diagnostic tests. I'm reliably informed by a doctor here that such tests, which include viral load tests, eye reviews, and skin problems, go for a minimum of 200,000, which is about the salary of a junior officer in police, who is a police constable. So this one could not afford. Spear gave us a hand. We don't want you to leave Uganda and forget that you had friends at your home back here. So thank you for giving us money to have income generating activities. We started small. In Nebi, we have more chickens than the police. You reach the market. Some people bought ducks, others who are not Muslims bought pigs, and they are there. So when you sell them, they use that money to buy the drugs they need, transport the hospitals, and to us that's not a mean achievement. I didn't want us to close here without thanking you. You gave us caregiver kits. Caregiver kits are small briefcases, orange in color. They help us run work. You realize we have about 30+ million people to police, and we are so few. We are about 40,000. The ratio of a police officer to every Ugandan is that I had the commissioner, my boss, talking about prisons office and the work they have done. I found we police 30 million people. And I want to tell you that we are the #1 beneficiaries of SPEAR. We've had the best achievements with the funds that SPEAR has given us, because we can't afford to have the man not working. So the caregiver kit has a cream that you apply on your skin if you have a problem. It has gloves. Those are the efforts that we've combined to ensure that things are better. So, on that note, commanders, allow me to express my heartfelt appreciation to our division, SPEAR, RTI, the colleagues on the grassroots, who have enhanced the collaborative approach that SPEAR came up with, such that even now we are here to share the experiences and compare notes. And to our American friends, I don't want you to forget us, this is Uganda. Uganda and America are like twins. We are together in Somalia. We are together in Afghanistan. We are policing this continent together. We are fighting immorality together. We can have SPEAR now as one, then we can have a phase 2. Phase 2, SPEAR 2, SPEAR 3. Because this story needs to continue. So I thought I should come here and request that you consider whichever proposals you're coming with. Thank you so much. God bless you.
And so thank you very much, World Vision, for a wonderful partnership, because I think that is part of what has been very instrumental into the success of the project. And so, yes, if there were a follow-on project, I think our partnership is well placed to continue the work which we have been doing, and for which I believe we have proven the capacity to be able to do. Just for a little bit of information, even if there were a follow-on project, the processes USAID uses do not allow for them to just give it to us. We need to compete like any other organization that may be interested in implementing this project, a follow-on project. And I think we would be very interested in entering that competition. And we hope that the work we've done with all of you, the experience we've had with all of you, will position us to be good competitors. But there is no guarantee whatsoever, irrespective of the good work we've done, that we wouldn't necessarily be the partners that would be selected. We really hope that we should, if there is a follow-on project, that they should select us because it makes it easier to continue the work rather than bringing in another partner who may stand. But USAID processes, in fact, do insist that there is competition. So I just wanted to clarify that if for some reason, and we hope there wouldn't be, we're not the next implementing partner, it's not because we were incapable or we didn't want to. It's just that there are processes that the US government uses to award these contracts that we do not have control over.
There were a couple of them that so badly wanted to be here and could not make it. Our contract officer, Alyssa Todhunter, who handles all the paperwork, dealing with dealing with USAID. And then we have Nikki Chalfant, our senior finance officer, who did happen to make it, and we're so grateful that she's been able to be here. She has been the backbone serving all the financial issues and matters in the past 5 years with SPEAR. And then our dear Melanie Lopez, the project manager, who has been in the woodworks, working day in, day out, supporting Erasmus and the team wherever she can. Unfortunately, she was not able to make it, but she told me to convey all her sentiments. I mean, the amazing work that the implementing partners have done in collaboration with the ministries, and she really considers you very dear to her heart, and is very sad she wasn't able to make it. And I myself am a design and development officer, so I worked also behind the scenes with your cost extension and support wherever I can along the way. I have to say that I want to thank you for all your presentations. I've learned so much today, and I just have to say on behalf of WVUS and the American people that you all are the heroes out here. We couldn't have done this without you. I'm sure we provided a lot of the resources, but without the strong relationships and the hard work that each of you have done and demonstrated here, and those that have not been able to make it, we really thank you for all that you've done. And if there is any slight chance that we can continue on, I will definitely be championing for a SPEAR 2 and SPEAR 3.
RPC Trovers Alex. Mrs. Grace Choda, Miss Grace Choda. Mrs. Gertrude Tibakanya. In case somebody is not here and you come from the same workplace, kindly come and pick the certificate for that person. Mr. Nangasia Masike, Mike. Miss Frances Cheng. Mrs. Kate Bagamba. Miss Frances Babazin. Dr. Michael, Dr. Kagwa. If there is a spelling mistake, you will bring back the certificate and we correct that. Dr. Kagwa. Dr. Steven Kaliejira. Miss Olivia Nakanwaji. If there is a mistake, you just go to the secretariat and they will definitely rectify that mistake. Miss Jessica Naluze, Ms. Florence Sembatia Musinguzi, Ms. Victor Alum, Mr. Charles Ziraba from Ministry of Finance, Mr. Alex Kusaule, Mr. Mlindwa Ismail, Ms. Akalo Barbara, Mr. Samuel Eitu from the Ministry of Local Government, Superintendent of Savit Ambrose, SP Savit Ambrose, Mr. Roran Biyawo, Mr. Paul Ogile, Minister of Local Government, Mr. Chitakule Hassan, Mr. Chitakule Hassan, I think is the last person. Ms. Frances Acheng, if somebody is here that you know how you could take it for her. Our park chairperson, we also want to recognize I want the Chief of Party to say a word before we call upon the members of PAC to receive their certificates.
So this is just a humble token to recognize your unwavering support to us, the SPEAR team. Indeed, for all these years, you've guided us, you have mentored us, you have supported us, you have gone to the field to see what we are doing. And so the Project Advisory Committee, we really like to thank you. It is just this small certificate, but I think it is something that we think together we should be able to do. So, I have the honor to have this recognition, Madam Chairperson, Dr. Subuga Yusuf from Ministry of Education. Yes, Ismail, you can come for the director of speak. Dr. Benson from Ministry of Health. Mr. Julius Kisaki. My chairperson is asking, why have you clapped? Why? Julius is the chairperson of the Teacher and Aides Group, a veteran. Dr. James Kisambu, I think he has left, but I don't know how protocol is, because I will not ask Mr. Kenya to come for it, but maybe I will ask Mr. Kagwa, who was in this role before, to come over and speak for Dr. James Kisambu. Mr. Kagwa? Dr. Kagwa? Dr. Kagwa? Dr. Kagwa, yes, come and pick, yes, come and pick for James. Sunny Mbabazi. Miss Sunny Mbabazi. She's the girl. The one and the only Charles Bidem. Mr. As Charles Bidem comes in. Today he is not in his uniform, but he would have saluted that today is not in his uniform. Thank you, Charles. We have Mr. Edward Mujimba from MINSOP, the Commissioner Labor. Okay, I will take yes, Jessica come for the boss's paper. Dr. Moses Yaruhanga, Director of the services. Now we would like to have the most seniorest person here, and I think we shall take the public relations officer to come. For this one, I would just like to call upon Roshan to come and hand over this one. Yes, it is being handed over to the only and the only chairperson, Miss Jane Wesley.
I don't do this work alone, so the work of the Ministry of Public Service is a teamwork, and when I'm not there, Moses is one of the staff of the ministry, and he does represent me on some of the forums, so we'll receive the certificate together. It's for the Ministry of Public Service.
Thank you. Thank you very much. This is not a PAC member, but Livingston Bagenda has been in the journey of SPEAR for quite a long time, and we say that really. Yes, and I would now like to call upon the chairperson officially close this function. As she comes on board, I would like just to say thank you. We meet again when time to continue working. It is just a normal process of closing the project. There's nothing like maybe there is a cutting or funding. No, it's just the natural way of closing the project, and therefore closing the natural way. Thank you, Madam Chairperson.
The management and the executive of SPEAR, the SPEAR Advisory Committee members who are present here, distinguished participants, ladies and gentlemen. I'm honored and privileged to be part of this success story. As we talk about all these success stories, as we end the project, this is not the first time I am part of this story. I started when I was still an assistant commissioner and I was in charge of policy in the Ministry of Public Service. And I led a team and we came up with the first workplace HIV policy for the public sector. So the public sector HIV policy was spearheaded in the ministry and I was actually in charge of that policy. So the policy we've been using in the public sector was initiated by my department and under my supervision. Then thereafter, because it became a success story, I was part of the team working with the Ministry of Gender, Labour and Social Development that we came up with the national HIV policy. I was part of that national team. So then later on, I became part of this success story as chairperson of PAC. So I'm really privileged and honored to be part of the success story. How many of you would not want to be part of a success story? How many? You know, when you start a project or you start a program, at the initial stages, there are not many people who want to join. There are a few who really are courageous because many people don't want to be part of a failing program or project. So they really procrastinate because they are not sure where you are going. But the moment you start registering successes, then many people start coming on board. So I want to thank all of you for being part of this success story. And to me, as I was seated there listening in and looking at the presentations that were being made, really this has been a success. So we need to congratulate ourselves for the success that we've been able to register. As I close this project conference, I want to just mention 3 things, because I know you are already tired. Just 3 things. One, I want to just mention a few success stories that I have had from the teams. Just a summary of what I have had in terms of the success stories. I also want to just give acknowledgement to teams and individuals that have made this a success. And I will conclude by talking about, making a call about sustainability. How do we move forward in terms of sustainability of the achievements that we've made so far? Now, from the presentations that have been made, I can mention that I'm looking at success in terms of the policies, the workplace policies that have been developed that provide an enabling environment for increased access to HIV services. To me, that is critical success, and it will help us to carry forward what we've done. The other area of success is in terms of capacity building for the target ministries and departments. So there's been capacity building, and I've listened to the stories that were being told in terms of capacity building. And this will also enable sustainability of the successes that we have registered. There's also been increased access to HIV services, and heard also about a lot of stories being told about the HIV services that have been offered throughout the period, throughout the 6 years. Testing and counseling, the BMTCT, circumcision, access to care and treatment. We've been able to establish 70 groups of people living with HIV and AIDS. We've talked about wrap-around services that include nutrition and income-generating activities, and so many that you've heard about. And they have been demonstrated here. And as a public officer coming from Ministry of Public Service, we always talk about issues to say that results speak for themselves. And I think today you've been able to demonstrate results that have been achieved throughout the last 6 years. The second thing I want to talk about, as I said earlier on, is acknowledgement. I want to take this opportunity on behalf of the government of Uganda to thank teams and individuals that have supported SPEAR to enable it achieve all these achievements that we talked about today. I want to thank USAID for the funding. I want to thank World Vision and RTI for supporting the implementation of the SPEAR activities. I want to thank the management and staff of the sector clients that have been mentioned here for embracing the project and getting the best out of it. I need to mention that there are many projects that have been started here in Uganda, and a lot of funds have been injected in these projects and programs. But at the end of the day, there are no results to speak for themselves. But this is a real success story where even the beneficiaries have been here and talking about the successes. And the way they talk about it passionately, it shows how much has been achieved. So I thank the target, the sector clients for embracing this and getting all these successes out of the project. I also want to call upon the beneficiaries. The beneficiaries of this, I want to call upon you to become the ambassadors. The ambassadors in terms of care, in terms of support, in terms of the way I listen to the people talking, you can as well, you don't need to have to wait for phase 2, but wherever you are, you become the ambassadors of SPEAR so that you continue giving the testimony of SPEAR activities, but also giving the advisory services, advising people on what they need to do in terms of care, in terms of treatment, in terms of counseling, in terms of circumcision, and all these other activities that have been done under SPEAR. On this note, ladies and gentlemen, it's now my pleasure to declare this end of project conference closed.
All the main partners, the stars, the PACE, the UHMG, all those partners, stars and whatever, we recognize you. We would like to recognize World Vision staff in the ADPs. You know, there is World Vision that we on the SPEAR program, but the World Vision, I'm sure they are being represented here by the Associate Director Support Services. We just stand to take our appreciation to the World Vision. And by the way, in the case of anything, the World Vision ADPs are in your regions and they have some resources which they can be able to use to support the activities. Know them.